Good afternoon, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And I'm so pleased to have with me in the studio Dr. Ziad Haydar, who is Senior VP and Chief Medical Officer of Ascension Health. Nice to see you.
Thank you.
Well, first of all, let's run over Ascension Health. What is the organization and what do you want to do in the space?
So Ascension is a faith-based Catholic delivery organization existing in 22 states and more than 30 locations. We have multitude of hospitals as well as multitude of physician practices and nursing homes and home care agencies, etc. Strategically, we have made a choice to be in the business of taking care of populations with a special focus on the poor and the vulnerable. And by population health, what we really mean is not too complicated. We are about improving the outcomes of populations with a focus on the quadruple aim. The quadruple aim is a focus on clinical outcomes, on service outcomes, on the provider experience, as well as doing all this at the lowest cost possible.
Okay.
And this distinguishes us from other organizations that are going to continue being in the fee-for-service model as long as they can. We are committed to not only switch to fee-for-value, but to be influential in leading the country in the switch to fee-for-value.
Okay, so in your mandate to provide good health care while still achieving the triple aim, how is that different from what organizations are trying to do now, especially in light of all the reforms that are going on in this sector?
Yeah, we believe that because of our size, and we're roughly 2 to 3% of American healthcare, we think that we can do more than following the change in the country. We believe that we can influence the rate of change in the country by driving markets to more fee-for-value contracting.
Okay, in terms of your negotiating power.
Correct.
With providers and
exactly.
And
With plans and with employers and having our own plans.
Yes, so you do have also your own plans.
In certain markets, and we're, yes, and we will have more.
What has been the most important thing to remember when trying to do this with your own plans? What strategy have you had to undertake to do that?
Yeah, I think the most important thing is the basic, is the most basic thing. The business we're in is about identifying the people we serve, identifying their needs, and then creating the care models, the interdisciplinary care models to take care of these populations. And the clarity around that focus is what drives everything else. So let me give a few examples. It's one thing to have a clinic that sees all comers. It's another to understand that individuals with diabetes have special needs that would benefit from a partner, from an associate who functions as a health partner to the people we serve and longitudinally help them with the control of their diabetes. That's very different from continuing healthcare delivery that's focused on the convenience of the provider rather than the needs of the consumer.
Of the individual, yes.
The ability to have the right care models for the right populations. So I gave you one example in the role of health partners with diabetics. We can talk about the roles of nurse practitioners making house calls to the frail elderly. We can talk about different care models relying on technology, on telemedicine for different customer segments, etc. As we think about these different models, that would allow us then to have the most value, which then would enable our fee-for-value models to be successful from a business perspective.
What are other takeaways you want to leave with conference attendees today about Ascension's mandate and your ability to achieve your goals?
What a sense of optimism, sense of confidence and optimism that the shift to a clearer focus on populations, on the communities we serve, is the most exciting thing that happened in healthcare since we've all been in healthcare. We think there's a great opportunity to rekindle the fire in the belly of the providers, to get providers to be more in touch with their vocation, with their initial desire to be in healthcare. We think that the sense of burnout, the sense of frustration that has been plaguing providers can be shifted, can be solved by the right focus on the right care models for the right populations, and providers can restore the joy of practice.
Okay. Well, thank you, Dr. Haydar, for your time today. We appreciate the time to
pleasure.
speak with you. And I'm Mabel Jong. Thanks for watching.